So we are studying the minerals. Okay. In the minerals, we discussed different types of macro macro minerals. So now we'll discuss about micro minerals. Okay. Micro. In the micro, the number one is iron. Okay. Iron. Iron is very important micro nutrient. Okay. Very important micronutrient. Okay. Micronutrient to required in the human body. Okay. And it is very important for hemoglobin. What it will do, it will carry the oxygen. So it is present in RBC. In RBC we have hemoglobin. In the hemoglobin we have iron. Okay. In the iron we have oxygen molecule. So then only oxygen molecule will bind with iron only. So if the deficiency of iron, we will have very important, very different problems. Okay. So iron is not only bind oxygen, it also binds carbon dioxide. To remove the carbon dioxide and to utilize oxygen in the body, we need iron. So what is the first function? To transport oxygen and to eliminate carbon dioxide. Okay. And for brain development, for brain development, very important is iron. Okay. And as well as uh, to regulate the temperature, we need iron. Okay. So what will happen when we take iron in the food? So it is absorbed in duodenum, small intestine. Okay. It is in the ferrous state. What is in the ferrous state? It is in the ferrous state. Okay. So we need vitamin C, gastric acid, and other substances. Okay. To convert all this into ferric acid, and to convert into iron. So it is a different part. We will not discuss here. Okay. So basically, we have to remember that it is absorbed in the small intestine. Okay. So iron absorption is increased during the demand. Whenever there is a demand, the iron absorption increases in the small intestine. In during deficiency also. Okay. So this is very important. Okay. Iron losses. How did iron loss from the body? It is from urine excretion, means excretion, sweat, bile, okay, and shading of cells. In this form, the iron is loses from the body. So mostly 1 milligram to 2 milligram per day, the lose of iron will happen. And in uh, menstrual cycle also, okay, menstrual cycle also, in the woman will loses 2 mg per day during cycle. And other forms we lost during bleeding or any injury, warm infection, childbirth. Okay, so these are the in that condition we loses ferrous from the body. Okay, so what is the required amount? RDA, daily required amount for men and women is nearby 18 to 21 mg per day. Okay, and pregnant women 38 mg per day, lactating 30 mg per day, children between 1 to 9 years, the required amount is 12 to 26. After that, required amount increase 34 to 41. Okay, in the girls, you need more. 16 to 18 years, you need 50 mg per day. 10 to 12 years, 19 mg per day. 13 to 15 years, 28 mg per day. 16 to 18 years, 30 mg per day. Okay, so this is the daily required amount. What is the sources of iron? Sources of iron are, so it may be in two form you will get. What is hem iron, and another form you will get is non-hem iron. There are the two types of sources available in the hem iron is present in animal source. Okay, like liver, meat, fish, poultry. Okay, non-hem is present in cereals, cereals, leafy vegetables. Okay, legumes, oils, means all the uh, non other than non-veg. Everything have most iron. Okay, what will happen if you will get the iron deficiency? Iron deficiency are in three stages. First is the storage will decrease. Okay, next deficiency in iron will happen. Next, a nutritional deficiency will happen. The storage will deficient happen, iron deficiency occur, nutritional deficiency occur. So when nutritional deficiency occur, you will see the symptoms like fatigue, pallor, breathlessness, exertion, edema, poor appetite, and in the children, growth retardation, hair fall sometime. Okay, these are the sign and symptoms you will get while iron deficiency anemia. Okay, next is the second important what we can micro mineral is iodine. Iodine is also very important. Iodine is vital micro nutrient, very essential for synthesis of thyroid hormones. For what we need iodine? Thyroid hormone or thyroxine hormone. We have T3 and T4. T3 thyroxine, T4 thyroxine, T3 is triiodothyronine. Iodothyronine. Okay. So why we need thyroid hormones? For cellular metabolism, okay, for growth metabolism, for growth, okay, for nervous system, muscle function, and a nutrient metabolism. For all this purpose we need thyroid hormone. All this purpose. Okay. So what are the function of iodine? Iodine is essential for T3 and T4. Mm. And already I told you that the thyroid functions are cellular metabolism, growth, nervous system function, muscle function, mental growth. All these are the functions of T3 and T4. Okay, so that's the reason thyroid hormone is very, very essential for the body. How much iodine required for the body? 40 to 50 micrograms. For children, 10 to, oh, sorry, 100 to 120 micrograms between 2 to 10 years. For adults, this is for infants, sorry. For adults, 150 micrograms. For pregnant and lactating women, 200 to 250 micrograms. Okay, this is the importance of uh, iodine source. We have seafoods. All the seafoods have iodine, like fish, liver oil, okay, and sea salt, and milk. You have other available in milk, meat, fresh water, water rolls, vegetables, and cereals. Okay, this is very important. What So whenever we take iodine, it is metabolized. We will indigestion, and it is enter into the small intestine, large intestine, where the absorption happens. After that, it will enter into bloodstream and utilized by thyroid hormone. Thyroid hormone. If the TSH, we have TSH, thyroid stimulating hormone. Okay, is this activity thyroid hormone activity is controlled by TSH? Whenever whenever TSH stimulate thyroid hormone, the necessary of iodine is increases because it need to do the function. So what will happen if there is deficiency of iodine? What will happen if TSH need to stimulate more to the thyroid hormone to release the T3 T4 hormone, because T3 T4 is not uh, making by thyroid gland, because of deficiency of iodine in the body. So what we have to do? We have to increase the intake of iodine in the body. Then gradually the thyroid hormone will become normal. Okay. So this is the second important micronutrient in the body. So what will happen? Deficiency occurs. Deficiency disorders. Okay. Goiter means the enlargement of thyroid hormone. Cretinism. Cretinism is a condition when infant born to severe iodine deficiency, characterized by low metabolic rate, weakness, mental restlessness, physical abnormality. Okay, so these are the important deficiencies that you can see through the deficiency of iodine. Next important micronutrient is fluorine. Fluorine, it is very abundant, is present in this nature. Okay, so 90% of fluorine is present in your teeth and bone. Okay, functions. What is the function? Essential for normal bone mineralization and the formation of dental enamel. So the bone mineralization, where the calcium will enter and stored, okay, in the bones to give the strength to the bones. So the fluorine, it is doing mineralization. Okay, and not only for the bones, but also in for the teeth. Okay, so fluoride is also very important for the body. So how much required amount is 0.5 mg per liter. So that's the reason in the water, sometimes we will get fluorine water. They will add in the water. tap water, you will get fluorine water. So you need 0.5 mg per liter. Okay. Some some regions you will need 1.2 mg per liter also. So sources is water. Water have fluorine. Okay. In some area you will get elevated level of fluorine. In some area you will get decreased level of fluorine. Okay. And other food sources are like sea, fish, egg, cheese, tea, and milk also contribute for fluorine intake. Okay. So first is iron, and second is iodine, and third is fluorine, very important for our body. Next micronutrient is copper. It is required for the body. It is also very abundant present in this nature. Okay, what is the function? Function is essential for several enzymes. Okay, like mediator, I told you that. And for blood cell formation, for RBC, we need copper. Energy production, we need copper. And for the connective tissue, we need copper. We require 2 to 2.2 mg daily requirement, and 3 mg in lactation and pregnancy. But deficiency doesn't cause that much issues, but sometimes anemia is seen due to the deficiency of copper. But excess intake may leads to some disorders. Okay, like acute infection, genetic disorders, sometimes, but not. Okay, so this is copper. Next, we have that cobalt. Next is cobalt. Cobalt is also present in abundant small form in the body, primary in the liver and kidneys, and it is a component of vitamin B12. Okay, functions for the synthesis of vitamin B12. Okay, which is very crucial for cell process and DNA synthesis and nerve function. What will happen if deficiency occurs? Deficiency occurs, then the vitamin D B12 deficiency also occurs. Next, we have uh, chromium. Okay, we'll continue. We'll finish fastly. Functions of chromium for a carbohydrate, lipid, and protein metabolism. And sometimes in the study shows that it is important for insulin function and glucose metabolism. Deficiency occurs may leads to impaired growth, and there is a difference between carbohydrates, lipid, and protein metabolism. Okay, the metabolism doesn't happen properly. Next, we have selenium. Selenium is also very important antioxidant, and it is required for immune function. Selenium. Okay, it will required for vitamin E. Vitamin E very important for along with vitamin E. Okay, to produce antibody. Okay, and reduce infection, reduce inflammation in the body. Okay, uh, so this is very important, and sometimes it needs in the conditions like malnutrition conditions. Selenium is very helpful for the body to improve the condition for autoimmune disorders. Okay, so these are the important minerals we discussed. Other minerals also present, but uh, which are least required for the body. We discussed uh, from the initial calcium, phosphorus, sodium, potassium, magnesium, okay, iron, manganese, iodine, zinc, fluorine, and other cobalt, copper, selenium, chromium, all these minerals we discussed. Okay, so important minerals are discussed, which are very important for our body. So this is about minerals. Okay, any doubts regarding minerals you can ask.